Yeah, my name is Hoyne. I'm a consultant psychiatrist and editor of Global Psychiatry Archives. And I sometimes report about interesting papers. And this is a scoping review about physician suicide from the Netherlands and the United States. So, what is the question and what you learn about that? You will learn what type of information is available in the literature over the last 100 years about suicide attempts by physicians. So in total, they looked at 1,596 articles, and 350 were looked at. So they used the PRISMA criteria to search for the appropriate articles. And in this scoping review, which I would like to explain what it is, the scoping review is different from a systematic review, where you have a single question and you find all the information about this one question. Here, in a scoping review, you want to find what's available about this specific issue. So it doesn't focus on one point, it focuses on more or less the landscape of information. Right. Okay, so they had a very comprehensive search strategy supported by librarians. They found articles, and we can see what type of articles were available. So, as I said, it started in 1900, and there was one article. There were lots of opinion articles initially, and later they got more data-driven articles. However, among these data-driven articles, there were quite a lot of cross-sectional studies, surveys, reviews, narratives, case reports, and very limited long-term follow-ups. So the number of opinion articles was in the hundreds, but there were, let's say, there were more opinion than non-opinion articles. Right, okay. So what happened then? So these articles were removed, and then there were studies excluded, which didn't focus on the subject. So for my mistake, 404 non-opinion articles and 143 opinion articles, which is a bit, even though you have some more non-opinion articles, data-driven, lots of opinion, lots of talking, and little data. So what information you get? You get articles which try to estimate the suicide incidence and compare them with the general population. I don't want to go into detail. The interesting part also is that there are different types of ways to assess suicide deaths. So death certificates, autopsy reports, medical examiners' offices, medical charts, professional membership master files, obituaries in journals, or family confirmation. From suicide attempts, there were different scales and questionnaires which were used, and for suicidal thoughts or suicidal ideation, there were quite different types of scales used over the years. The interesting part is also that and this is that there estimated suicide clusters. There was some idea of suicide contagion. There was some where they referred to stress, distressing work conditions, but one of the big nasty or different suicide epidemics, as you can call it, also was during the Holocaust, when older dermatologists didn't see any future in their life under the Nazis. Right, there are other studies to estimate suicide and suicide attempts. Suicide ideation was a bit more common. The interesting part is also that mental health and burnout played an interesting role in assessments. So these are the outcome measures, and sometimes the samples show the different. The population of the studies was quite different. So we had residents, attending physicians, medical students. So there are quite different views, even for opinion articles. The interesting part is, I hope I find it here, what is the specialty? And sadly, it's psychiatrists and anesthesiologists who have the highest suicide rates. It's a question whether it's the special knowledge of the anesthetists knowing what kills them compared with others. They had less previous suicide attempts, so it seems they knew what to do and how to kill themselves. On the other hand, there were also some suicides with firearms, prescription overdose, and hanging. So the question is whether the fact that physicians have no previous suicide attempts, that they are more successful in the first suicides. Psychiatrists is another group who have lots of suicides compared to others. That might be maybe the experience with their patient clientele, but I don't know. So that's something to be examined. Personality traits, cultural contexts is something which might be a specific issue, but this again is one issue which needs more research. Gender over the years was more relevant later, because earlier in the early 20th century, psychiatry, or most of the doctors, including psychiatrists, were male. So only in the 70s and 90s, 17, 18, 90s, female suicide was an issue. Right. So there's some physician-specific risk factors, which was they have more access to lethal means. They know how to kill themselves, or they understand the body, and maybe they have a bit of more burnout than some other jobs. So this is the what's usually published. So it's suicide risk factors, mental health problems, the context, let's say practice, culture, stigma, then epidemiology, population, gender, substance abuse, education, wellness, that's all examined, treatment, policy issues, family problems, responses, prevention, theory settings, legal issues, but very little about post-prevention and public health. So on the other hand, when you look at what should be done, we should look more at whatever the basics of prevention, post-prevention, and public health. There should be more studies on wellness, education, treatment response, risk factors, and the theory of suicide. So what happens and why does it happen? So the understanding of suicide is not comprehensive. There are lots of studies, and the authors have, I think, done a great job to clarify some of the data. They refer to data limitations, that some of the data are difficult to compare. Suicide mortality ratios are difficult to compare because different bases of calculations have been used. Right, this was a bit of a long explanation. I hope you learned a bit, and if you want to see more, please check this article on www.globalpsychiatry.co.uk. You can search for suicide, you can search for the authors, just mentioned. So if you want to have a look at the authors to find the article, I think it's Leung, Snyder, Pendahar, Chen, who have done this job. And I think they've done a great job. If you want more information like this, please subscribe to our channel. Thanks for listening and have a nice evening.